Monsieur Jutra, what brings you into the ER tonight?
I got a horrible pain in my belly and I feel like I'm gonna vomit.
Okay. Well, tell me more about this pain.
It's all down in this area here. Came on about 5 o'clock this evening. Along with it, I began to have some difficulty going to the bathroom. I felt like I had to pee all the time, and it would really hurt when I did take a pee.
Okay. What kind of pain is it? Sharp, stabbing, dull?
It feels like my intestines are being squeezed. It comes and it goes.
And you've said you're feeling nauseous. Any vomiting?
Nope.
Okay. Any constipation or diarrhea?
Nope.
Okay. Have you tried anything to make the pain better or worse?
Well, I tried a couple of Tylenols earlier. My wife had recommended them, but they didn't have any effect.
Okay. Have you experienced anything like this before? Do you know what may have brought it on?
Nope, and nope.
All right. So I'm going to do a physical exam and see what may be going on. Hi, Dr. Martin. I was wondering if you had a moment to discuss my patient, Mrs. Jutra.
Okay, but make it quick. We're really busy tonight.
Okay. Monsieur Jutra is a 54-year-old male with a 6-hour history of abdominal pain located in the lower right quadrant and suprapubic region. He describes his pain as intermittent, gripping, and associated with nausea, but not with vomiting, diarrhea, or constipation. The patient took 2 Tylenol earlier this afternoon with no effect. The patient also complains of dysuria and frequency for several hours.
Okay, go on. Did you do a physical exam?
The vitals are blood pressure 120/90, heart rate 78, respiratory rate 24, temperature 35.9. I also did an abdominal exam which showed diffuse abdominal tenderness, guarding, and hyperactive bowel sounds.
Okay, so what's your plan?
I've already taken the liberty of ordering 3 views of the abdomen, a chest x-ray, some blood tests, and a urinalysis to rule out gastroenteritis, perforation, and a UTI. The chest x-ray was unremarkable. The abdominal x-ray showed no free air and unremarkable intestinal gas pattern. The blood test showed hemoglobin 135, WBC slightly elevated at 12.7, neutrophils 92.3, and normal electrolytes. The urinalysis was normal with no RBC or WBC.
Okay. So what's the next step?
So I think I've ruled out perforation and the UTI. So Monsieur Jutra might have gastroenteritis.
Okay.
I think we should give him some Gravol for the nausea and some morphine for the abdominal pain, and observe him in Emerge for the next few hours. In the morning, I can run an exam to see if we can send him home. Would you like to see him just in case?
Well, I'm really busy right now. Why don't you go ahead with that plan? And this is your first day in Emerge, isn't it, Joanne? Well, you're doing really well. All right. Let me know how he does overnight.
Thank you. Hi, Dr. Martin. I'd like to update you on the status of Monsieur Jutra. I gave him the Gravol and the morphine just like we discussed, and he's feeling much better now.
Okay.
On exam, the pain was significantly decreased. The abdomen was soft with no tenderness or guarding. I think we can send him home.
Okay, great. Complete his discharge, and he's good to go.
Okay. Hi, Mrs. Jutra. I'm glad you're feeling much better. I've consulted with Dr. Martin, and based on your history, physical exam, and the investigations that we did, we think you have gastroenteritis. Now, it's nothing to worry too much about. It may blow over in a few hours or days. What you can do in the meantime is take Gravol for the nausea, and for the pain, you can take Tylenol 1 and Buscopan.
What if the pain gets worse?
Well, if the pain does get worse, or if a fever develops, you should see your family doctor or come back to the emergency room. Do you have any questions?
Well, wait a minute, this is the worst pain I've ever experienced. Are you sure it's not something more serious?
Well, gastro can be painful, but you are improving. Have a wonderful night, and I hope you feel better soon.
Well, I'm really depressed and angry since my appendix surgery. When I spent 2 weeks in hospital and I still don't feel ready to go back to work. That young doctor really missed the boat on this, and at my expense.